everybody? Welcome back. Today we are going to be using the Theracane. We're going to go through how to use it to do a little bit of a soft tissue mobilization on the neck. A lot of times people try and get it and kind of move it around, and it's just such an odd area. Everything's so curved, everything's so small that to get on a spot and to kind of do more of like a traditional massage can be really hard. Definitely can do it when you're getting a little bit more onto around those shoulder blades, onto the back. That's gonna be a great way to use it where you're actually digging in and kind of doing some of that more traditional massage. But especially if you're looking at the neck, to try and kind of drag it across and move it around, it'll usually just kind of slip off. Usually hurts a little bit whenever you're doing that. So we need to learn how to do it a little differently to get the best results that you can. Best way I like to use the thing is more of an active release. So we're gonna be kind of pinning those tissue structures, and then we're doing some movement off of that to try and get those tissues to relax and release, to give you better movement, a little more muscle activation, and just feel better overall. So taking a little knobby in, we are gonna put that right kind of around the area that you have that pressure. I usually try and work away from where I feel it the most to where it is the tightest, or where I have a big knot or something like that. So I'm gonna start a little bit more kind of right on upper trap, kind of right in the middle. I'm gonna try and kind of anchor my shoulder down, and then I'm gonna move neck going away. Do a couple of those, and then I'll kind of move spots, get a little bit closer to where I feel it is the tightest. And right there, yeah, feel that spot. Just add that little movement in there. Just really try and get those tissues to release and to relax through a little bit of movement. You can play around with different angles of that movement. Different angles. If you're a little bit more in front, typically you're gonna go a little bit more behind. You're kind of gonna go opposite. If you're a little bit more behind, tend to go a little bit more front and to the side. You can also do it to those little muscles on the back of the neck. Just add that little bit of movement. If you want, you can add just that little bit of a glide where you're just kind of rotating the hands just a little bit to kind of follow that movement and that motion. Those are some of those little advanced technique kind of pro tips that you can add into it to make it just that much better and get that much more out of what you're doing with the Theracane. That's the best way that I really like to use this, is getting that active release, getting that nice little pin and stretch as you're moving to loosen up all those tissues and get you moving again. If you like this video, make sure you like and subscribe to our YouTube channel. Keep bringing you videos to keep you living an active and